Hello, everyone. I'm Anne Marie Schieber, and welcome to the Heartland Daily podcast in video this week. Today, I am going to talk about the nation's healthcare system and, how we can make it more personally focused than having so much intrusion by government and giving patients more control over their healthcare. Of course, this issue is going to get a lot of attention in the months coming up with Obamacare being considered before the Supreme Court, and Congress is chomping at the bit to do something about healthcare, both Republicans and Democrats. And there is, of course, the big concern about insurance issues and pre-existing conditions. So I have as my guest this week someone who knows the subject of pre-existing conditions very well. I met Melissa Davert right after Obamacare went into effect. Melissa and her family have a unique situation. They deal with significant healthcare disabilities, and before Obamacare, their healthcare needs were met pretty well. They got their insurance through a private company, and then after Obamacare, everything turned upside down, especially for the children. They want to work, they want to take care of their needs, be independent, save for the future, just like everybody else. But in the current situation, healthcare has been a challenge. Melissa, it's good to see you again.
Oh, good to see you too, Anna Marie. And I'm so glad that your focus is remaining on this very important topic.
Well, it's been 7 years. Hard to believe that time has passed. When I first met you and Obamacare went into effect, the kids are now young adults. Tell us about your family and how everybody is doing right now.
Well, we're hanging in there like everybody else. It's crazy times, but we're doing well. The kids are now 22, and Austin has just graduated from college with a bachelor's degree in health information management. And my daughter is 3 semesters away from her degree, bachelor's degree, and she's going to be doing social media marketing, and she hopes to work in doing some marketing for the medical field somehow.
Wow.
And so, yeah, they're go-getters, and they're working hard to make their goals and dreams come true. So we're very proud of them.
They're like one step ahead of the game, a subject that they're well acquainted with. And, I want to share some of the video that we shot 7 years ago. And this is a video, Andy, if you're able to show that, pop that up. I did a mini film documentary on the Daverts, and we're going to turn the sound down just so you can sort of see the pictures. But this is the video that I released when I was with the Mackinac Center in Michigan in 2014. And it shows the day-to-day living that your family was doing. I think this was around Christmas time, and that's your husband. And the 2 children are also in the video, and we interviewed them. They were very impressive. My goodness, they were just teenagers at the time and so articulate on some really complicated subjects about healthcare. And they all were, you were going through a rough time trying to save your healthcare because, like we said, everything had changed like overnight for you. You want to tell us a little bit about what was going on at the time? I know you were just filled with anxiety that you were going to be stuck with no coverage.
We were. It was frightening times and frustrating times. And I think one of the most frustrating parts of the whole thing was decisions were being made without including the people that their decisions affected. And so I think that people failed to see how certain segments of the population were going to fare when all the chips settled. And so at the time, before Obamacare, we had a private plan for each of our children. And it wasn't the super great policy, but it covered, your basic needs. And the thing that we particularly appreciated about it was it had a family max for both children of $2,500 a year. And so we knew that whatever our expenses ended up to be, that's the amount that we needed to budget for every year, that we could end up having to pay as much as $2,500 out of our pocket every year for medical care. And so that was affordable to us. And so when Obamacare kicked in, um, we weren't too concerned at first because we were told by Barack Obama himself um, that we could keep our plans. So we weren't too worried about that. And then several months before everything kicked in, we received a letter from Blue Cross, and I still have the letter to date, that specifically said that they were writing to tell us that our current plan did not meet all the requirements of the healthcare reform law, and it would be discontinued on December 31st, 2013.
Now I want to
And
stop right here because this was the spot where you were on the phone with them and you had waited hours and they hung up and you were just so frustrated, even just signing up for this. So then what happened? Did you go without or just, fill us in from there?
well, um, well, we were forced to find something else, obviously, because what we had we could not keep. So as you see in the video there, we applied on the marketplace for health insurance, and the I believe the software that they developed did not fit the my face right there, because that was about the fourth time I got disconnected after waiting hours and hours and hours. Um, and they told me I hadn't even applied, and I had already applied like 3 or 4 times before that. It was a mess. I think
Yeah.
the software itself did not fit a family in our particular situation, because they kept trying to refer us back to the Medicaid program, as I recall, and we didn't want Medicaid. We wanted a private plan. And
Yeah.
so we tried like 5 times to apply, and finally how it all got resolved, I think the national healthcare, who was it that was in charge of the website? um
Oh goodness, I don't even remember. I
it's
know.
the federal government program that was in charge of the website. One of the legislators or somebody had saw, I believe, your interview, and saw the frustration that we were having getting through, and they started to work on the software itself and corrected the glitch, and we were finally able to at least get a plan, but it wasn't a plan that was anywhere near the plan that we had before this all started. The best plan we could have that fit our family had instead of a $2,500 maximum amount that we would have to pay out of pocket for the 2 kids, it went up to $10,200 a month.
Wow.
So
Yeah.
when you factor in a monthly amount, that's like $800 a month that we could have had to pay out of pocket if we had a catastrophe situation health wise with either of our kids. So the liability was incredible. And the increase in the liability was astronomical. And this was supposed to be a program, I thought, that was supposed to help people that was in having terrible health care situations and health needs. And for us, it was not the solution.
Tell us why Medicaid is not necessarily a good solution for people with significant pre-existing or disabilities.
Well, I think in our society, somewhere along the line here in America, we've come to believe that people with significant disabilities, like myself, are just naturally prone to poverty. That we're supposed to be taken care of, and that we're supposed to um, have a different level of lifestyle, I guess, from other Americans, because that seems to be the solution that is laid out for people like us, is that we go on Medicaid. And to get on Medicaid, at least as it stands right now here in Michigan, you have to be in poverty. You can't have more than $2,000 in assets. You cannot be, working and receiving any significant amount of money to qualify.
Mm-hmm.
And so when it came to time when my kids were looking for insurance as adults, That was really the only solution other than an extremely expensive Blue Cross Blue Shield plan with a high out of pocket max or Medicaid. And they don't want Medicaid. They want to go to work. They want to save for their future. They want a lifestyle like everybody else has, and they want to work for it. And the way it stands right now, for them to get Medicaid, they would have to deplete their savings. They would have to, or there's another program called My Able. I don't know. Are you familiar with My Able?
No, I'm not. I assume it's a state program with MI.
It is. It is, but it's federally supported in some way. It's like it's a private savings that people with disabilities can use to put money away that won't be counted against them when considering benefits such as Medicaid.
Yeah.
But my daughter and son do not want to go on that program because once you put the money in there, to get it out, you have to pay a fee for it. You have to pay a fee to get their own money out. There is a fee for every withdrawal that you make. So they have to give some of their money away. They can only put it in a certain designated account. So they can't pick and choose the investments for their money. They
Yeah.
have to go with this particular investment account. But the worst part of it is once they put the money in there, they can only use it for specific things related to their independent living. Like they could use it to buy food and basic needs, but if they wanted to use it to go on vacation, they couldn't use their own money to go on vacation. But
So
they could get health care.
we have somebody lording over how they spend their money, and
Exactly. How can that be that that should be okay for them, but not for the average college student? I don't understand how that's okay.
Yeah, no, I could see a lot of people would agree with that. Tell us a little bit about your family situation. Tell us about the disease that you and your children have, and what your husband does, and how you're coping with all of that.
Yeah. Well, we have a condition called osteogenesis imperfecta. It's a brittle bone. Well, it's a brittle bone condition. It's caused by a lack of good collagen in the bones and muscles. It also relates to the muscles and tendons. So our bones fracture easily. And so from time to time, we may have a broken bone or require surgery to have a metal rod installed in our arms and legs. But we basically do all the things that regular families do. I mean, the kids go to school. My husband's working at a grocery store in the maintenance department, and we do what every family does, and we have a pretty productive life, and we just do what we need to do to get by, like everybody does today, I guess.
Yeah. Do you run into any obstacles involving healthcare in terms of choosing your providers, or even getting coverage for things that you need to get by?
Oh, absolutely, constantly. Because, well, let me go back to explain that now that I thought Obamacare was supposed to open up options for everyone as far as a wide variety of plans that we could choose from. And for our family, at least, in the county that we live in, there's really only one plan every year that fits our needs through Blue Cross. That's it. We have really no choice. Or if we don't go with that plan, we'll have so many unmet needs and anything else that it's totally unaffordable. So it's getting easier to pick the plan every year because, like I say, there's only really one plan
Yeah.
that we can choose. So this plan, unfortunately, well, it has like a zero premium,
Hmm.
but the out of pocket max every year is $4,500 per child. So the liability is still much higher than the original plan we had.
Right.
And the other really big challenge is that almost any major thing that the kids might need to have done. Like my daughter needed surgery last year, has to be pre-approved by the insurance company.
Oh,
Like
yeah.
I can remember a time when you would buy insurance and your doctor would decide what you needed and let the insurance know this is coming, and they would pay what the doctor recommended. But times have turned, and now the doctor asks the insurance company what you need or if you can have it, and they tell the doctor if the person can have it or not.
Yeah.
And so
Then your doctor has to spend all this time working with the insurance company, trying to convince them that this is worthy.
they
And
spend a
they
ton.
get involved.
Yeah, the doctor wastes a lot of their time bartering with the insurance company over particular patients' needs. My children's doctor had to spend a ton of time writing letters, submitting paperwork, just so Michaela could have her surgery. It just doesn't make sense anymore. And it's scary because the insurance companies are making decisions about patients they know nothing about. They don't know my particular needs. They don't know my daughter. They've never seen my daughter face to face. And yet they're making decisions based upon something that's on a piece of paper.
Right. This idea of a public option, I don't know if you know what that is. A lot of people are confused by it, and we haven't really gotten a whole lot of details of what that's going to be. Or the idea that you could qualify for Medicare at a younger age. We've also heard of Medicare for all. Do any of these ideas sound like they would be a solution to someone like you?
Well, I would be greatly surprised if they're offered to everyone regardless of income, or I'm assuming they're gonna put some kind of financial restrictions or something on eligibility, I would imagine, to begin with. And that would definitely be a problem for people with disabilities. The second thing is that a lot of doctors, they don't want to take Medicaid or any of those other programs. So finding doctors that'll even accept those kinds of plans is a challenge. So our choice of doctors could be very limited.
Right.
I do have concern, and of course, you hear stories in other countries that have 100% government supplied healthcare, and what do you have? You have long waiting lists, and don't hold your breath getting the care that you need.
Yeah.
Those are concerns of ours too.
Yeah. So I think in the past, a lot of states, and some states are now doing this, although I don't know, the future is very much up in the air. But states were able to set up risk pools for high need enrollees in insurance market, and all the insurance companies would contribute to this risk pool so that insurance companies could take care privately of needs such as your families, and you could get affordable insurance. But now states are sort of restricted into what they can do. They get a lot of money for Medicaid expansion, but it goes directly towards expansion in Medicaid, and people again don't have any control over that money. It goes directly to the insurance company through either subsidies or they have to pay for the plan outright. Does the idea of giving you more options in the private individual market, having private care, maybe perhaps a high risk option through the private market, and having access to an individual lifetime savings account that would have some tax advantage to it, that you could keep forever, and that would be tax sheltered, and that you could use for healthcare needs in the future, does any of that sound attractive to you?
The high risk pool is an interesting subject. Michigan used to have it. It seemed to work for my family. We were part of that high risk. I think that I don't know if it just wasn't implemented properly, but it seemed like after a while, the insurance premiums for that group of people started getting so high it became unaffordable for people like me to continue up the premiums. The one thing I like to say is that I graduated from Northwood University. We are a self-reliant philosophical college that believes in self-determination and little government intervention, and I'm all for that. It's easy to see that so often government gets involved and it's a disaster. You have bureaucratic policies that don't make sense. You have high costs. The private sector can do things so much more efficiently. I think they're a better watchkeeper over the funds. I think private insurance companies do a very good job of making sure that money is spent for the proper purposes. And sometimes to a fault. I think sometimes they can make it a little too difficult sometimes to get the care you need, but that's another subject. But I think keeping the private in health insurance industry going is an important way to do it. The only concern that I have is if you leave it totally up to the private insurance companies to move forward with healthcare, you're going to see people like us be weeded out. Um, Obviously, they're there to make a profit. I mean, that's obviously what they do. And people like me are not profitable to them who have higher level health insurance needs. So, somehow or another, in my personal opinion, I think it's important to keep the private insurance company going. But I think that it's equally important to include some sort of, I don't want to say a prop to the industry, but you're going to have some kind of government assistance for these companies in order for them to accept people like me. Because if you just leave it up to them, we're going to be pushed out through premiums that are too high to pay, or out of pocket maximums that are going to be unaffordable, or they're going to only serve territories that have an average lower age population. We're going to get kind of squeezed out. So, somehow or another, there has to be, and if it's a risk pool or, um, I often thought of, I think right now they have some insurance programs that are in the trial stage where they're actually subsidizing um, private companies, giving them a subsidy to
Mhm.
accept people like me.
Yes,
I think that's a fabulous idea.
that's what Medicare Advantage is. They take a wide range of people with different needs and pay them, the providers, more money depending on the need. And so the provider has an incentive to provide care efficiently and well. And then they might even specialize what we call sometimes centers of excellence, where they have more knowledge about taking care of someone perhaps with diabetes and be able to manage it in a more cost effective way. Does that idea appeal to you in any way, that we can create a market for people with significant disabilities, give the providers more money, and they would be interested in providing care because they're getting more money for it? What about this idea of centers of excellence, where maybe you would have your healthcare handled by somebody who's really specializes in your needs?
You mean like a department or something that oversees it? Or I guess what would the center of excellence? What are you
Well,
referring to?
right now in the individual market on Obamacare exchanges, you're really excluded from some of the top-notch healthcare providers. If you have cancer,
Right.
for example, and I know of this example of in Texas where many of the plans don't even cover like MD Anderson, which is like one of the top cancer centers. And if you get treatment there, they might be able to do it a lot better and a lot cheaper and more efficiently than some place that is not used to providing that kind of specialized care. So, like you wouldn't need to drive 2 hours every day for basic appointments, but it's something along those lines where you could have access to really top-notch experts who could solve the problem quickly. You
That'd be
ton of doctors.
utopia. Actually,
Yeah.
yes, yeah,
I mean, like
yes.
when
Or
things
it.
changed from Obamacare, didn't you have to change providers after that when the rug was pulled out from underneath you in regarding care? You were getting some care at some top-notch centers, and then all of a sudden you weren't sure if that care was going to be covered.
Well, absolutely. But fortunately, most of our care is done through University of Michigan, and they so far have been pretty liberal about the policies that they will accept.
Yeah.
But around here locally, it's much more difficult now to get. Well, actually, our family doctor is no longer accepting the insurance that Ken and the kids have. So we had to go with a different doctor for our basic needs, our family care needs.
Yeah. Well, I mean, there's just so many complexities. They probably have their reasons for why they're unable to work with your insurance company. But in any case, I mean, as we start to wrap things up, what is it that you would like legislators in Congress and even at your state level to know about people with pre-existing conditions, and what would be the best way to address those needs?
Well, I think the best way to address them is just to provide incentives for us to have access to the same kind of care that people without disabilities have, that they focus on ensuring that the private markets can continue, finding ways that we can still participate in the private market. It would be great. I mean, then we would have access to the same doctors that everybody else has. You know, I think those are my primary concerns right now. And and the other thing is help us to discover ways to minimize the out of pocket when you have extreme disasters, medical disasters. An auto accident, or I guess auto accident's a different ball game altogether, because then you're having auto insurance involved. But I mean, like cancer issues, or do we want people to become destitute when they become sick? And right now, how the system is set up, that's what happens. You have an elderly parent who becomes sick and needs special care. Um, their entire life savings are gone, or they can't even afford the monthly bills that they will incur as a result. We need to develop policies that will encourage us to be able to maintain self-reliance through difficult times.
Yeah. I mean, right now, the way people have a very difficult time saving outside of the healthcare system so that they can have more control over that spending. And of course, a lot of the costs are so driven up because we do so much excessive spending, and all of it paid, much of it paid by the federal government. So, I would invite our audience, and I know I shared with you, it's very new. The Heartland Institute came out with the American Healthcare Plan. It's a free market, pro-liberty alternative to government-controlled care. There's some really good proposals. A lot of the things that we've discussed here today are included in it, and we're getting some feedback. So we hope that, Congress and legislators at the state level will find that useful in trying to address this huge problem that just is not going away. It's getting bigger. So thank you again, Alyssa, for joining us and talking to us from Michigan about your family's healthcare situation and why more government healthcare is not the option, but healthcare that's probably more personally driven, where you have more control of it.
Oh, thank you. And thank you for working on this. Like I say, it's good to know that people are staying focused on it. And, one thing that I'd just like to say about Obamacare when it kicked in, the policies sounded great if you didn't need to use them. The lower premiums is great. Some offer, over-the-counter medications for free. But if you needed to use them because you had an issue, is where it became a problem. And so whatever we develop in the future, if we can think about those that eventually need to use them, it needs to be a product that will help and fit the needs of the people who are sick. That's what it's there for.
I mean, a lot of people didn't value the Obamacare plans, and they dropped out, and that market shrank. And the whole point was to address the uninsured segment of the population, and really didn't make much of a dent in it. So thank you again, Melissa Davert from Michigan, and telling us today about your healthcare situation. You'll have to come back.
Thank you.
Posted. And
Thanks so much.
And I want to thank our listeners and viewers for tuning in. It's always a pleasure to bring these free market discussions to our audience. It really helps spread the word about free market healthcare. And if you have heard some point of view of someone very much impacted by the market, you know that the magic that the free market can do if there is a need, that minds in the private market can pretty much, when they work together, do find solutions. So pass the word along, share our link, and our podcast, become a sponsor to the Heartland Daily podcast. It really does, again, help get the word out. Thank you for joining us today, and I'll be back next time with another discussion from Healthcare News.
Thanks for watching this video. Please subscribe to our channel and consider donating to the Heartland Institute to support more vibrant free markets, greater individual liberties, and more videos like this one.